This video is an overview of VPRIV, velaglucerase alfa, a prescription medication indicated for long-term enzyme replacement therapy for patients with type 1 Gaucher disease. Important safety information. Life-threatening hypersensitivity reactions, including anaphylaxis, may occur with VPRIV treatment. This reaction may occur early in treatment or after many doses. Seek immediate help if you experience wheezing, shortness of breath, trouble breathing, itching, hives, rapid heartbeat, swelling of the tongue or throat. VPRIV should be administered under the supervision of a healthcare professional. Appropriate medical support should be available when VPRIV is administered. Please see additional important safety information at the end of the video and click the link in the description below for full prescribing information, including warning for risk of anaphylaxis, and discuss with your doctor. What is type 1 Gaucher disease? Type 1 Gaucher disease, or GD1, is a rare genetic condition. People with this condition don't produce enough of an enzyme called glucocerebrosidase. When there isn't enough of this enzyme, a fatty substance called glucocerebroside builds up in cells and causes those cells to swell. This may affect different organs throughout the body over time, which is why GD1 is considered to be a progressive condition. The signs and symptoms of GD1 may present in different ways for different people. Symptoms can include tiredness, weakness, stomach discomfort and pain, bruising, and bleeding. What is VPRIV? VPRIV is an enzyme replacement therapy indicated for long-term use for patients with type 1 Gaucher disease. VPRIV was evaluated in pediatric, aged 4 years and older, adult and older adult patients, where safety and efficacy were established. VPRIV is specifically designed to match and replace the naturally occurring human enzyme that is missing in GD1 and replicate its job in cells. VPRIV is absorbed into the cell. Like the naturally occurring human enzyme, VPRIV breaks down the fatty substance, glucocerebroside. This reduces the overall amount of the fatty substance in the cell. Why might you consider VPRIV? Finding the right treatment for yourself or for a loved one is a vital part of any patient's experience with type 1 Gaucher disease, so it's important for you to feel confident in your choice. VPRIV has over 10 years of real-world experience. It was first approved by the FDA in 2010 and has been indicated for long-term use to treat patients with type 1 Gaucher disease ever since. VPRIV was studied in the largest clinical trial program of an ERT for type 1 Gaucher disease. Up to 99 patients in various life stages, 4 years and older, were evaluated across 3 clinical trials and a long-term extension study. VPRIV is the only ERT for GD1 that is made from a human cell line, an ERT specifically designed to match and replace the natural human enzyme. This design is intended to facilitate targeted uptake of VPRIV into cells. VPRIV is administered as a 60-minute infusion, taken once every other week for patients 4 years and older who are new to treatment, under the supervision of a healthcare professional. Indication: VPRIV, velaglucerase alfa, for injection is a prescription medication indicated for long-term enzyme replacement therapy, ERT, for patients with type 1 Gaucher disease. Important safety information. Life-threatening hypersensitivity reactions, including anaphylaxis, may occur with VPRIV treatment. This reaction may occur early in treatment or after many doses. Seek immediate help if you experience wheezing, shortness of breath, trouble breathing, itching, hives, rapid heartbeat, swelling of the tongue or throat. VPRIV should be administered under the supervision of a healthcare professional. Appropriate medical support should be available when VPRIV is administered. Hypersensitivity reactions were the most commonly observed side effects in patients treated with VPRIV in clinical studies. The most commonly observed symptoms of hypersensitivity reactions were headache, dizziness, low blood pressure, high blood pressure, nausea, tiredness/weakness, and fever. Hypersensitivity reactions in the clinical trials include any event considered related to and occurring within up to 24 hours of VPRIV infusion, including 1 case of anaphylaxis. Generally, the reactions were mild, and in patients not previously treated, occurred mostly during the first 6 months of treatment and tended to occur less frequently with time. After the drug was approved, Additional hypersensitivity reactions of chest discomfort, difficulty breathing, itching, and vomiting have been reported. In some cases, vomiting can be serious and require hospitalization and/or stopping the medication. If anaphylactic or other acute reactions occur, seek immediate medical care. Your healthcare provider will immediately discontinue the infusion of VPRIV and initiate the appropriate medical treatment. A hypersensitivity reaction should be treated based on the severity of the reaction. Your healthcare provider may manage a reaction by slowing the infusion rate or treating with medicines such as antihistamines, fever-reducing agents, and/or corticosteroids, or possibly stopping the medication and then restarting with a longer infusion time. For patients who have had symptoms of hypersensitivity reaction to enzyme replacement therapy, the doctor may consider treating the patient with antihistamines and/or corticosteroids before an infusion to help prevent such a reaction from happening. The most commonly reported side effects during clinical studies, in greater than or equal to 10% of patients, were hypersensitivity reactions, headache, dizziness, abdominal pain, nausea, back pain, joint pain, increased time it takes for blood to clot, tiredness/weakness, and fever. In clinical studies, the overall frequency of side effects was generally higher in the patients not previously treated with ERT than in the patients who switched from velaglucerase to VPRIV. Talk to your doctor if you are pregnant, plan to be pregnant, are breastfeeding, or plan to breastfeed. The safety and efficacy profiles were similar in pediatric, ages 4 to 17, and adult patients. The safety of VPRIV has not been established in patients under 4 years of age. Side effects more commonly seen in pediatric patients compared to adult patients include greater than 10% difference, rash, increased time it takes for blood to clot, and fever. The side effect profile in elderly patients was generally similar to that seen in pediatric and other adult patients. In general, dose selection for an elderly patient should be approached cautiously, considering other existing medical conditions. As with all therapeutic proteins, there is a potential for developing antibodies to VPRIV. In clinical studies, one of 54, 2%, patients who had not previously been treated with ERT, who were then treated with VPRIV, developed antibodies. One additional patient developed antibodies to VPRIV during an extension study. It is unknown if having antibodies to VPRIV is associated with a higher risk of infusion reactions. Patients with an immune response to other enzyme replacement therapies who are switching to VPRIV should continue to be monitored for antibodies to VPRIV. For additional safety information, please see the link in the description for full prescribing information, including warning for risk of anaphylaxis, and discuss with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information, contact Takeda at 1-877-TAKEDA-7, 1-877-825-3327, or by email at medinfous@takeda.com. If you think VPRIV could be the right treatment choice for you or your loved one, speak to your doctor and visit vpriv.com for more information.